And so now I'd just like to invite Jim to give a brief overview, and then we can work through the topics then after that.
Thanks, Gavin. So just, I suppose on behalf of the Matter team, and you're meeting 3 of the members of the team tonight, we'd just like to say thank you very much for organizing this. We've always found the PKUAI to be a very engaging body, and we look forward to very positive engagement into the future. So we are representing, as I say, the team on the adult metabolic side, who are located in the Mater Hospital. We're a national centre now for inherited metabolic disorders in the Mater, and that is, we have some nice things to report tonight. But I suppose before we get into it, I just wanted to set the scene, and I suppose maybe many people on this call will know this, but the concept of inherited metabolic disorders in an adult hospital or in an adult medical setting is a relatively new concept across the world. So this unit here is up and running, really since around 2013, 2015. So it's still very much in its infancy in comparison to the centre that exists in Temple Street, which is, has been around for at least 3 decades and has had generations of professionals rotating through, and it's built. It takes time to build these things. So we are still in the building phase, but we are continuing to progress in the right direction. Just briefly, and we'll probably get into this a little bit later on, we have recruited a number of new staff in the last few months. So we've added to our nursing pool, our dietetic pool, our admin pool. We're looking to recruit a genetic counsellor, and we're also looking to recruit a data manager and a research assistant alongside a consultant. So that's all very positive, and will continue to bring the service along. The second thing is that we've commenced I suppose, a solid transition clinic, which is, a process by which to bring patients who are aging out of Temple Street into the adult world as such. So that has taken, that is a lot of work has gone into getting that up and running. A lot of work, particularly from Alison and Barbara, who are here, have to get that process up and running, and we now have an established clinic for that. Alongside that, we have a number of international connections established as well. Different clinics have been established to run alongside other international clinics as we are building up the expertise and the service within the unit. We've sent a number of people to the SSIEM, which is the metabolic meeting, recently from the department, and we also ran a European-wide precision medicine course here in April, where we had people from over 50 countries, 400 representatives tuning in to the Matter here. And that was fronted by the metabolic department, and that course is actually going for an Irish Healthcare Award as well. So there's been lots of positivity, and I'll stop talking now, and I'm happy to take your questions, and Barbara and Alison also.
I don't see too many questions in the chat just yet, Jim. You mentioned there's quite a number of staff. It's great to see this is happening. In relation to, I suppose, one of the questions we had, or one of the topics we wanted to discuss, was the rollout of Kuvan, specifically. Where exactly are we at with that? I assume it's going to be staff dependent, really, isn't it?
Yeah, it is, and that's how we've always said it. I mean, we're certainly preparing ourselves, to be right there. So once we can go, we can go. We have prepared by making sure that the patients that are attending here have had their genetics done, and so we will be able to identify patients who will likely be responders immediately. and also the group of people who are potential responders. But we will have to take it one step at a time, of course. So there's a staffing issue, and then as we roll this out, we will gently ease into it.
Okay.
But it's very much top of the agenda, let's say. Okay.
Yeah, I would imagine it is for the community as well, Kuban. I suppose another issue that was brought up recently was around bloods and the delays in getting bloods back. And, you know, some adults at our recent meeting said it would be great to have a similar text messaging service that we have in pediatric care. Where are we currently at with that?
So, Barbara, do you want to lead out on this one, or?
Sure, Jim. So I suppose just to introduce myself, I'm Barbara Gilman, and I'm the dietitian manager in inherited metabolic disorders. And I suppose the turnaround time for our bloods is something that is also very much on our minds. And I suppose just to give the context of how we actually get the blood results. So as you'll all know, the bloods are analysed in Temple Street, and then the results are loaded up onto a national IT platform, which doesn't at the minute talk to our IT bloods platform in the matter. So the text messaging, unfortunately, isn't possible until we can actually get bloods directly from Temple Street to our IT platform. We have looked at ways around this, and there is an IT platform that would do this for us. It would link the lab in Temple Street directly to our IT platform, and we are in discussions both with the Mater and Temple Street to see if we can move this forward. That would be the first step in actually just getting the blood results in a more timely manner, and it would set the groundwork for us to be able to look at a text messaging system. So we're very cognizant that the text messaging system is there in pediatrics, and particularly, as Jim said, you know, when you transition and you transfer to the Mater, it is a changing process, and the results do take longer to turn around. So as you say, we are working on it, but it's an IT, I suppose, solution that we need. But we certainly feel that we have made some ground, and we would be hoping again that we'll be able to work on this further, you know, in the coming months, and certainly will be a priority for 2023.
Yeah, maybe I can just come in on a point. You were saying you were talking with some international clinics and trying to draw on their expertise. I've had interactions like with a lot of overseas PKU patients, and they talked about a system where the patients can actually access a portal that, like a web application or a web portal that would store the results on it. It would actually probably be more efficient than a text system. Like, is that something you've looked into, or is it something that's possible? I know it's maybe it's security reasons, or maybe it's funding and getting a vendor to supply it, but have you considered that solution at all?
What I can say, Gavin, is that we're constantly trying to improve our service from all different angles, and this obviously is one of those things that we have to get right. And you know, why do we do what we do? I mean, part of it, I suppose, is there's a traditional thing to it, and we have been sort of mirroring what has been happening in Temple Street to a large degree. But we're constantly in touch with the IT, as Barbara said, the IT department here around, you know, the best way to get that out. But we would be open to receiving suggestions in from PKUAI on this issue for sure.
Because it is a big issue, I suppose, in terms of dietary adherence, you know, to manage effectively. Right now, patients are saying they wait up to 2 weeks to get results, and the minimum standards of care under Statement 16 of the European guidelines are, you know, less than 5 days. So we want to support the adult services to make that happen in any way it can. So I'm glad that there's work, it's been looked at, because it is a priority for the community. So that's great to hear, Jim and Barbara. Thank you for the update.
If I might just add, if that's okay, I suppose our turnaround times are for our maternal PKU service, and the levels are reported directly to the patient the day that they arrive in the lab. Our turnaround time for our planning pregnancies and postpartums would be 3 to 4 days. And I take your point completely for the other patients with PKU that don't fall into these categories. Our turnaround times are probably somewhere between 5 and 12 days, and completely that's outside, once you go over 5 days, the European guidance. But once we send that level in the post, and there is absolutely no delay. There is no waiting time if patients want to ring to get dietary advice when they get that level in the post to say that their level is high. And we don't have a specified day for phones, and there's somebody kind of available most days when patients ring to actually discuss if they have a concern when they receive their level. And I would really encourage patients to please ring us when you get those results if the levels are above your target range.
Okay, thank you, Barbara. Just in relation to prescriptions, it's the next item on the agenda. There have been some delays with prescriptions. Patients are saying, if they're not engaging with regular blood levels, perhaps this might present with an issue. And in other instances where I suppose people weren't comfortable wearing the mask, coming to clinic if they had anxiety levels. What is your response to this? Are there delays with prescriptions or not at all? From your perspective?
Yeah, I mean, all I can say is that we really work to facilitate all the patients that attend the unit here, and try to factor in all of the, I suppose, the stresses of life, and COVID hasn't been easy for a lot of people. The policy is that for all the patients that attend the matter, it's not just the patients with inherited metabolic conditions, that that we would want them to attend once every 12 months. And that's not about just to get a prescription. Like, that is really for your general medical review. So there are, as people get older in life, different things happen and so on like that, and that would be standard as well if you were going to a GP, that ideally your doctor would like, and your medical team would like to see you probably on an annual basis, which is probably not unreasonable. So I mean, I know that this has come out, but all I can say is that we really do try to facilitate for everybody, and allowing for their own personal circumstances. And I do understand that they sometimes have to travel from Kerry and from Donegal, and so on. And we have looked into it, around the pharmacy, and what is allowed by pharmacists and so on as well. So that's my response to that, Bernadette.
Okay. And of course we can't discuss individual cases or anything like that. But in relation to, and so a good news story is the Mevalia food that has become available, which is magnificent for the community to see new products become available. And it has been greatly welcomed. And I suppose from the association and from the community standpoint, we appreciate the work that the staff do in order to support those GMS applications. Thank you. And this is a really good opportunity to thank you for your work in that area. In relation to applications, I know that there are other food companies such as Cambrook, for instance, who have been trying to come into the Irish market for some time. And a lot of Irish patients have been asking, to gain access to these products. They have to go through some kind of palatability study. Could you explain that and what stage it's currently at?
Yeah, sure. And I think, Alison, do you want to come in here? I think you're
no problem at all. Can everyone hear me?
Yeah.
Yeah, brilliant. So yeah, I was very minimally involved with the Cambrook study that was done through the hospital. We had a researcher that was working on it with Sarah Ripley. We closed out our side on March 3rd, and Sarah has reached out to a number of other people with PKU to do the tolerability and the tasteability subjects. And I actually met her at SSIEM, and we had a really good talk about it, and she has informed me that she's going to submit everything to the HS. Does that clear that up?
We're just lost you
I
on the
think we
last
lost
part
you
there,
on
Alison.
the last bit. She's ready to submit to the HSE. Is that what you said?
Sorry, apologies. Yes, I did. So Sarah has informed me that she is submit in. Can you hear me?
Oh, I think we might have to move on. Unfortunately, connection's too bad, Alison.
Sorry, if I turn off my video, is that any better?
Yeah, you sound better now.
Okay, great. Sorry, it's probably just the Wi-Fi out in the country. So Sarah has informed me that she will be ready to submit all the paperwork and all the documentation in November of this year.
Okay.
And how long does the process take after that, Alison, do you think, or do you know? Is it hard to gauge? And which specific products have been applied for?
So we won't know that until Cambrook release that data to us. So it looks like the build would be a big one, and a few others that she had mentioned to me, but off the top of my head, I can't remember. I apologize, Bernadette. So I think she mentioned about 4 or 5 that they were going to submit based on the taste test that the very good people who agreed to do it submitted their preferences to. So she will hopefully send me a copy in November of everything, and I'm happy to share that information with you as to what they've submitted.
Yeah, that would be great. And I can pass that on to our members in our database. It's probably the easiest thing to do.
Yeah, perfect. So she did tell me that she would get in contact with me in November and give me an update.
Super, thank you.
And can I just say that the process usually takes, in terms of, this goes into the HSC procurement, and it usually takes, after the submissions, it takes about 3 months. And then, you know, so all going well, if they're approved, we would be hoping to see them in the market early next year.
Yeah, I just noticed that, as somebody has in the chat, they have a question around Mevalia foods. So those Mevalia foods are available to adults as well as the pediatric patients under the GMS scheme. It's the same. It's just, I think some adults received emails with an update on the new food products and others didn't. So and maybe that's why that question has been posed.
Yeah, so absolutely, they're available for both peds and adults. And I suppose just to say to you that that it'll be the middle of October. If some of your members, maybe they may or may not know this, that the pizza bases from Mevalia, which look absolutely fantastic and seem to be a much more superior product than what was previously available, as well as the product, it's one of their sliced pan breads from Mevalia, and they will be coming available from the middle of October. So they will be the 2 last Mevalias that will come into circulation.
Okay. Just in relation to Kuvan, I see a few questions there posed about Kuvan trials, how they work, daily visits involved, etc. Do you want to give a brief overview of that, James? I'm just conscious of time, and maybe if there's more detail, maybe it's something that could be emailed.
Yeah, I think we can. I don't think like there is a protocol that has been developed, you know, for that, and it depends on a number of different factors, and obviously your genotype as well feeds into that. So I think rather than getting into the fine detail of that, we can circulate something to that effect.
There's also a question there in relation to age of transition, James.
Yeah, so the transition clinics, as I say, have started now, and they were, I mean, well, recommenced, let's say, maybe that's the way to say it. So the transition process will start, you know, it depends on the patient and depends on the condition, and of course, it's for all inherited metabolic conditions. We must keep in mind that we have about 1,000 patients coming to the unit at the moment. In around 300 or so have PKU, but there are 700 or patients that are so depending on the condition, the transitioning process will start at a certain age. So usually, let's say 12 to 14. It depends on the maturity of the patient as well, of course, and so on. And then over the course from that point until they come up to the matter here, they will be probably attend 2 to 3 transition clinics, whereby different members of each profession will go to each clinic. So not always will a nurse, for instance, be required to be there, but perhaps the dietitian will have to be down there, or the social worker, the psychologist, or the genetic counselor when we get one. So we will be tailoring the package, if you will, the transitioning package to the patient, and I suppose the type of condition that the patient has, and so that's really it.
Yeah. Can I ask a couple of questions? One question just from myself about the acceptability studies. Do you reach out to patients to inform them about them in clinic, or how would it normally work? Because I'd only found out through the association about the Cambrook study, and they're basically acting as recruiters, or not acting, but like trying to raise awareness about it. I never knew anything about it from the clinic, and I believe there's a Metabolic study as well, similar. I never heard about it.
I suppose it depends on the PI, the primary investigator, the principal investigator, and how the studies are set up. I personally am not the principal investigator, for instance, on Cambrook.
Yeah.
So how we communicate that to the patient base does vary, but perhaps I mean, we, you know, as I say, PQAI have always been a very engaging and receiving body, and you know, perhaps we could maybe work on establishing a firmer pathway around that. I think that's a fair point, Gavin.
Yeah. There was a question there, maybe for Barbara. Have you got a timeline for the implementation of the text messages system, and has it got maybe, I don't know if you can say, but it's got budget approval for it?
So the text messaging system, the first step is that we need to get the IT platform that will bridge the results coming from Temple Street, coming directly from Temple Street to the Matter IT system. As I said, currently what happens is the blood is analysed in Temple Street and then it goes up on a national IT platform, HealthLink, that might be familiar to some people. And so the first thing is that we need to get the blood results directly into the Mater Hospital. Once we can get the blood result directly into the Mater Hospital from Temple Street, which is what we're working on at the moment, is the first step. And as I say, we have had conversations. That IT solution is there. And it's that, you know, it's working with both IT departments to see when we can actually try and put that in place. When we get that, and again, you know, that is a big piece of work for both Temple Street and the Mater, then we will be in a position in the Mater to look about a text messaging system. But until we get rid of the middle ground, which is the national IT system, HealthLink, we can't look at text messaging. And, you know, something, just reflecting on what you've said tonight, you know, about, you know, a portal, you know, we need to, I think, you know, kind of maybe also look to see, you know, is text messaging the best way? That's, as Jim said, you know, there's historics here and what has happened in Temple Street. But as they say, you know, once we have to get this first step done in terms of getting the blood directly into our IT system from Temple Street. And then it's how do we communicate? Text messaging is probably the road that we've been thinking about, but there is, I think, you know, we haven't set up anything. So we're in the unique position that we can maybe kind of consider if there's other ways of doing business that are, you know, that you have kind of alluded to.
Yeah. Can you comment at all about the length of the Kuvan trial in comparison to some other countries? Some people seem to consider it a bit short here in terms of testing of responders. And maybe that's.
I might just add, Jim, do you want maybe to comment on that?
Well, so I suppose there are different scenarios, Gavin, and it's I would prefer, I think, to handle that by perhaps a I mean, we could give a formal reply that could be circulated to PKUAI, because there's lots of different sort of nooks and crannies to that. So that would be, that's what I think would be the best way to approach that.
Okay.
I mean, all I can say is that we are very much on board about getting Kuvan in, and we're very, very much on board about giving our patients the best service possible. And I understand that there is frustration out there, and trust me, it's on our side as well. And we are working. We've made a lot of ground in getting this sorted, and we're not far off.
And Jim, just because I'm very conscious of the time in your case, can you tell us how prepared are we for clinical trials? That was something that was on the agenda as well. I'm just conscious that we've submitted information and research from our patient group last April for Palynziq. For those that are attending the meeting and might not be aware, the PKU Association have done that on patient experience to help support the application of Palynziq enzyme replacement. How prepared are we if something like that or other drugs coming on down the line, if they're to be trialed in Ireland?
No, absolutely, Bernadette. So, as we say, we're building the unit, and we're building different layers to the unit and different arms to the unit, and we're going to have a clinical trial arm. Maybe supported by the research assistant, alongside linking in with the data manager, and we're going to be building into the European reference networks and so on like that. So that's very much on our building agenda, let's say, and I would be very hopeful that we will be in a very strong position to be able to roll out any of these novel therapies very, very efficiently, and also be able to put our patients in touch with clinical trials in other jurisdictions. And as I said, the European reference networks will form a large part of that. So the idea is really to build a connectivity that we are going to be wrapped into the European initiatives as well, and that patients right across Europe will be able to access the various therapies in a timely manner. So it's, no man is an island, and we're very much thinking along those lines. So the goal here is to make this an A-class metabolic unit.
I've no doubt, and we're really understand that you are working with limited resources in the adult unit at the moment, and I hope through our efforts, in advocacy and adult patients sharing their experience further will help to support that even more, to help to make it an A-rated facility. So I think it's really important that we work collectively and we support one another to try and make this work and make it work well. And continue to work collaboratively in every aspect, so that's really, really important. I'm just going to check that I don't know if there's any additional questions. There's been further comments about prescriptions, of course, and I know each individual case is different. However, they must attend one visit per year. Is that the protocol again around prescriptions, or is it, how does that?
Yeah, so I mean, that is what is the policy, and I didn't invent that policy. That is that's a generally held policy. So, but of course we will work with each case in point. But as I say, a patient doesn't attend to get a prescription. A patient attends for a medical, dietetic, nursing review. Make sure that everything is going well in their health, and that's the way to see it, rather than attending to make sure that you can get a prescription.
Okay. I don't know, has anybody got any further comments or questions to make? Any other comments?
Have you
Just-
ever considered or any sort of remote or tele medicine, or do you be more encouraging people attending the in person?
So yeah, and I was actually going to bring this up, Gavin, to get an idea of, you know, what the feedback on, you know, telehealth clinics in general, like, you know, from a patient point of view. But no, I think like going forward, you know, COVID has changed how medicine will be practiced indefinitely, I think. And there's going to have to be a blended model whereby you will have to attend sometimes, and then sometimes it will be completely appropriate to have your appointment, you know, over telehealth. And that is the way we will be teeing up as well. And that makes sense from so many different angles.
Yeah, I know that outreach centres were proposed at one time, or community workers to help to support adult patients in the community. Is that still happening, or is that something that's not happening now? Yeah.
Barbara, do you want to talk to that, or will I go again?
And yeah, I can speak to if you wish, Jim. Yeah. So we're delighted to say that we have just opened up a PKU outreach service, that is delivered by a dietitian. And the service basically is to provide additional support for patients in their own homes, in addition to the ongoing standard of care and level of care that we give as the team in the metabolic unit. So we have just actually started that, and it's something that we will be exploring in up and coming appointments with you as you come. If we kind of feel that there is maybe a particular aspect of your diet that, you know, we feel would be of benefit, that if you were able to get a little bit more support at home. So that service has gone live, and that service is actually a joint initiative between both Temple Street and ourselves. Temple Street haven't gone live yet, but as I say, just this week the first referrals actually went.
That's very progressive, and it's very positive to hear that, you know, everybody can be accommodated in their own circumstance. Thank you, Barbara. I think we'll have to wrap it up. We appreciate your time. It's been a wonderful event, and it's great to connect with the community. Hope we can build on it further. I'm just wondering, does anybody have any last final comments they wish to make before we finish up?
Just and a further meeting at some stage next year as well, you know, you know, just to really be reassured that we are working, you know, to really make sure that we have full engagement with the patient group. And we know how much work PKUAI have done, you know, particularly in the last number of years in helping to facilitate the care for the patients attending the unit. So thank you.
Thank you, Jim.
Yeah, I think that's it. That we've answered most of the questions that we can there, and discussed all topics that were raised through social media as well. So thank you very much for your time this evening. I understand you're under pressure to get to so I would like to think like it's good that we can engage like this and try and work together for solutions. Like there's maybe some subjects I couldn't touch on, but like I think there's a lot of concern out there at the minute from patients just with managing the blood and getting access to substitutes and even just basic foods. And I think it'd be great if we could work together to try and get more products available to us, and also try and pressure or lobby for more access to treatments and products as well. So thank you very much, and I wish everybody a good evening.
Thank you.
Okay, I'll stop recording now.
Thank you very much.